Hi everyone. I'm recording. This recording is to help you, hopefully, with your PAL assignments, Practice Anatomy Lab assignments. Um, Let me go to the list of your assignments and let's look at one of them. Look at one of the first ones. Sometimes they'll be PAL cadaver and sometimes it'll be PAL model. The cadaver assignments are hardest to me. But so since they are the hardest, I think I'll just go to the first one on blood vessels. Um, well, the first one that was due was on the endocrine system, and from what I saw, you guys all did pretty well on that. I mean, you at least passed it. So the one that's due today is on blood vessels. So let's just open it up, and I'm going to go to the student view, and we're just going to look at a few of the questions. And this is typical of the questions that you'll see on a PAL quiz. If it's cadaver, that means it will be on a human cadaver or dead body. So they're asking you for, well, what does the question say? Which structure is highlighted? And you can see in red, there's a structure here that's highlighted. If you look at the whole structure, you can tell that it's a blood vessel that's near the ankle. And it says deep fibular nerve, anterior tibial artery, anterior tibial vein, or dorsalis pedis artery. Now, more than likely, you don't know the answer to this. So what are you going to do? So I'm going to close this out. And then I'm going to go to what's called the study area and launch the study area. And I'm sorry I haven't shown you guys this before. I guess thinking you're in about by 169 that maybe you knew it. But in the study area, you can go to Practice Anatomy Lab. So we want to go to Practice Anatomy Lab and then we want to open it up. So this is the button that you use. You open it up. And then we want to go to the human cadaver. And we want to go to the blood vessels. Well, cardiovascular system, and within cardiovascular system, we want to go to the blood vessels. Now, the way this is set up, there's a self-review, and on the self-review, if you want to, you can select a structure and it will show you what it is. Like this is the temporalis muscle, or I can select this structure, which is the external, sorry, it's hard to see, the external jugular vein. And I can do layers. I can go deeper and go into the second layer, which shows me even more blood vessels. Let's see what this one, no, hold on. It's not showing me these, but, well, if it's not highlighting it, then it doesn't, you're not supposed to know it. But this, okay, this is one that's highlighted. It's called the facial artery. And then I can go even deeper and go to the deep blood vessels. This is the common carotid artery. Okay, but this is not the picture we want to look at. We want to look at the picture of the foot and the ankle. So we can actually, oh, and this is something I just noticed this, that actually was, when we did layers 1, 2, and 3, that was the first 3 slides. Every time we went to a deeper layer, that was a different slide. So we go slide 1, 2, 3, and we're going to keep looking until we see that picture of the foot. And this activity would be really hard to do if you didn't have something, some kind of resource to help you. And that's not, All right, I think it's this one because it was held open. So it's one of the deep anterior tibial vein and anterior tibial artery. Be really careful that you know which one it is. Let's go back to our practice anatomy lab that we were the not study area, but oh, I must have gotten out of it. I'm sorry. No. It's on a different tab. Okay, so we go back to this. Here's the picture that we're looking at. What structure is highlighted? Okay, look at it real carefully. Does it look like the anterior tibial vein artery? And then we're going to look back at the picture. That is the anterior tibial artery. Right beside it is the anterior tibial vein. So the vein looks like it starts near that pin that's holding open the muscles, and the artery goes deeper. Both of them are anterior tibial, that's their name, anterior tibial blood vessels. So when I look back at, look back at my question, that one looks like the artery, okay? So the anterior tibial artery. I don't know if it gives me the answer or not since I'm doing it as a student. I guess it doesn't give me the answer till the end, but you get the idea. This is how you do it. And you go on to the next picture and then you find it in the practice anatomy lab. Now, another way that you can study for your lab practical exams is after this, you can go to the quiz. The quiz will give you choices, but what you're doing on your assignment, your PAL cadaver assignment, is you're doing some quiz questions and then some lab practical questions which ask you to just type in the answer. But this is where you go. You go to the study area, open up a whole nother tab, and that will help you through. Now, if you're getting all your answers and not learning them, it's not going to help you on the practical exams. So try to use this as a study tool, okay? So anyway, I think that's probably all that you need. Don't want to make this too long.